What is premature ejaculation? Premature ejaculation is when you have an orgasm before intercourse or sooner than you'd like during sex. It can be frustrating and even embarrassing, but PE is a common issue for anyone with a penis. About 30% to 40% of those assigned male at birth have it at some point in their life. So, keep in mind that it's not something to worry about if it happens only occasionally. Premature ejaculation can happen from time to time. If it occurs regularly for you or your partner, there are ways to get help. Premature ejaculation time. There is no set time when you should ejaculate during sex, but if you ejaculate and lose your erection early, you and your partner may feel there's not enough time to enjoy it. If you ejaculate within 1 to 3 minutes of penetration on a regular basis, or are unable to delay ejaculation during sexual situations such as masturbation, you may want to talk to your doctor about treatment options. Premature ejaculation causes. The cause of PE isn't really known, but your brain chemistry could be at least partly the reason. People with low levels of the chemical serotonin in their brains tend to take a shorter time to ejaculate. Psychological causes that can play a role include stress, depression, anxiety, guilt, relationship problems, lack of confidence or poor body image, concern over your sexual performance, negative feelings about the idea of sex, early sexual experiences, sexual abuse. Premature ejaculation risk factors. Some physical conditions may also cause PE. You may be at risk for PE if you have any of the following conditions: unusual hormone levels, irregular levels of neurotransmitters, inflammation or an infection in your prostate or urethra, genetic traits you inherit from your parents. Sometimes, PE can be a problem for people with erectile dysfunction. That's when the penis doesn't remain firm enough for sex. Those who are worried they could lose their erection may develop a pattern of rushing to ejaculate. It can be a hard habit to break. Treating the erectile dysfunction may make the premature ejaculation go away. There are many medication options, so discuss any concerns with your doctor. Premature ejaculation diagnosis. To diagnose PE, your doctor may start by asking if you've always had the problem or if it's a new thing. They may ask about your sex life or your relationships. You'll probably get a physical exam, too. If your doctor thinks emotional issues are causing your PE, they may refer you to a mental health professional who works with people who have trouble with sex. If a physical problem is causing it, they might recommend that you see a doctor called a urologist, who specializes in conditions that affect your urinary system. Premature ejaculation treatment. Treatment could start with you seeking counseling. A psychologist or psychiatrist can help you work through problems such as depression, anxiety, or stress that may be contributing to your PE. Other ways to treat PE include premature ejaculation pills. Your doctor may also talk with you about medication. While there aren't any drugs specifically approved to treat PE, medicines used to treat other things may help in some cases. This is called an off-label use and not approved by the FDA, so be sure to discuss it with your doctor. These include antidepressants. A side effect of some selective serotonin reuptake inhibitors is delayed orgasm. But these medications also have side effects that include nausea and drowsiness. They also can throw a wet blanket on your desire to have sex. So, you may be trading one problem for another. You and your doctor will decide what's right for you. Tramadol. This is a pain reliever that can delay ejaculation. It may be prescribed if antidepressants don't help. This medicine is addictive, so it may not be an option for you. Medications for erectile dysfunction. These drugs may also help you maintain an erection. They include sildenafil citrate, tadalafil, or vardenafil HCl. Anesthetic creams or sprays. Instead of pills, you can put an anesthetic cream or spray on the head of your penis to make it less sensitive. Leave it on for about 30 minutes. It must be washed off before sex so you don't lose your erection or cause loss of sensation for your partner. Premature ejaculation home remedies. About 95% of people are estimated to recover from PE with the help of psychological, medical, and behavioral therapies that help control ejaculation. You can try the following behavioral techniques at home. Start-stop. You or your partner can stimulate your penis until you feel like you're going to have an orgasm. Stop the arousal for about 30 seconds or until the feeling passes. Start the stimulation again and repeat 3 or 4 more times before you ejaculate. The squeeze. It works the same way as the start and stop method. But, when you feel like you're reaching orgasm, you or your partner squeezes the head of your penis until you lose the erection. Repeat this a few times before ejaculating. Some people find that if they think of something else during sex, they can last longer. If those don't work for you, you can try a few other things. Strengthen your muscles. Weak pelvic floor muscles sometimes contribute to PE. Kegel exercises may help strengthen them. Find the right muscles to tighten by stopping your urine in midstream. Hold them tight for 3 seconds and then release them for 3 seconds. Do this 10 times, at least 3 times a day. Wear a condom. It may desensitize you enough so you can last longer. Get busy before you get busy. Some people find that masturbating a few hours before sex helps them stay in control during intercourse. Ayurvedic medicine for premature ejaculation. There is limited research on whether Ayurveda, a traditional form of medicine from India, can help treat PE. Ayurvedic treatments can include practicing yoga, taking herbal supplements, and changing your diet. Premature ejaculation complications. If your relationship is affected by PE, talking about the problem is an important first step. A relationship counselor or sex therapist may be able to help. PE may also make it hard to start a family because the sperm may not reach an egg to fertilize it, or depression related to PE might affect your sex drive or performance. A fertility specialist can talk with you and your partner about some other options. Takeaways. Premature ejaculation can happen to anyone with a penis, but if you feel it's happening regularly, there are ways to address it. Talk to your doctor to see if counseling, medication, or behavioral techniques can help you last longer. Whether you have goals to start a family or just want to have more satisfying sex, you can get support from a variety of healthcare professionals. Premature ejaculation FAQs. What is the main cause of premature ejaculation? There isn't one main cause of PE. It could be due to a range of psychological and physical conditions such as stress, depression, anxiety, guilt, relationship problems, lack of confidence or poor body image, concern over your sexual performance, negative feelings about the idea of sex, early sexual experiences, sexual abuse, unusual hormone levels, irregular levels of neurotransmitters, inflammation or an infection in your prostate or urethra, genetic traits you inherit from your parents, erectile dysfunction. How can I fix premature ejaculation? You can get help for PE from your doctor. They may recommend counseling, medications, or behavioral techniques to try. What is the average time of premature ejaculation? PE occurs within 1 to 3 minutes of penetration during sex. Why'd I only last 30 seconds in bed? There could be multiple reasons why you're ejaculating sooner than desired. Talk with your doctor to determine if the reasons are psychological, emotional, or related to a physical condition.